Do you know more than 80% of men and nearly half of the women experience significant hair loss during their lifetime? 1 in every 4 men start balding before the age of 21, hereditary being the most common. So what causes this hair loss? What are the different types? And are there any solutions for the same? To get answers to all these questions, keep watching this video. Hello all, myself Dr. Rahul Jagiasi, hair restoration consultant and hair transplant surgeon at Visage Aesthetic Clinic, Kharghar, Navi, Mumbai, India. A warm welcome to all my viewers to my YouTube channel. So today I'll be discussing the most common causes of hair loss, different types of hair loss and their treatments. Most common causes of hair loss are certain genetic conditions and other epigenetic factors like improper diet, stress, sleep patterns, too much of screen time, most commonly seen in kids these days, hair pulling, or due to the polluted environment around. It can be a cause of psychological distress in a person if he's too young, and also can lead to a lot of anxiety and depression. Coming to different types of hair loss, they are androgenetic alopecia, also called as male pattern baldness, female pattern baldness, Telogen effluvium, AnagenFuel, Alopecia areata, and lastly traction alopecia. So I'll be briefing you all with each of them along with its treatment. So we will first know the most common form of hair loss, that is androgenetic alopecia or male pattern baldness. It is the most common cause of hair fall in men. It is passed on within generations. Thus one needs to look at their relatives and find out if there had been cases of hair loss that runs in their family, like maternal or paternal side. Hair loss in this condition immediately starts after puberty and continues progressively. Most commonly seen in males in the age group of 25 to 35 years. It is seen as progressive thinning of the hairline along with the corners, where hair is lost in a well-defined pattern beginning just above the temples. Over the time, the hairline goes back to form a M shape. Hair also thins at the crown, which is at the top of your head, which may progress to partial or complete baldness. This is a contrast to female pattern baldness, wherein hair becomes thinner all over the head and the hairline does not go back or recede. Androgenetic alopecia in women rarely leads to total baldness. So the main reason behind this hair loss in males is the male hormone, also called as dihydrotestosterone or DHT. Increase in levels of this hormone at puberty and in subsequent years shortens the hair growth cycle and causes the development of shorter and thinner strands of hair, only in cases who are genetically sensitive to this condition, like in hereditary causes. In addition, the creation of new hair to replace these old strands which are fallen out is delayed. It is very important to seek help and talk to a medical professional. Hair loss in early stages can be easily reversed in men. The male culprit obviously being conversion of DHT. It can be stopped by medicines and topical solutions which will further enhance hair growth, and the areas which have lost all the hair roots can be addressed by a hair transplant. So another type of hair loss is telogen effluvium, wherein hair shedding arises during the telogen or resting phase. It is usually caused due to prolonged fever, emotional stress, acute weight loss, like in case of dieting, poor diet, post-pregnancy, or during periods of any major ailments. Due to shock caused by all these, there can be increase in hair loss, and mind you, at its peak, about 70% of your hair can turn into telogen phase and fall. This condition though doesn't cause complete baldness, and in all cases it is self-correcting. So eating the right diet, plenty of proteins, fruits, vegetables can induce hair growth, and if your hair loss is more, then definitely you should consult your hair specialist. Coming to the third type of hair loss, that is AnagenFuel, which refers to hair loss that commences during the growth stage of your hair cycle. It has shown to cause diffuse baldness. In contrast to telogen effluvium, where hair shedding onsets during the resting phase of your hair growth cycle, this occurs in the growth phase of your hair growth cycle. This is generally caused by infections, toxin, radiation used in cancer treatment, Also in cases undergoing chemotherapy, patients undergoing chemotherapy suffer from this condition. So the treatment for this condition remains topical minoxidil solutions, 2% of 5%, scalp cooling in cases who are undergoing chemotherapy, and some other lifestyle modifications. So coming to the fourth type of hair loss, also called as alopecia areata. It is a common immunity disorder which causes uncontrolled hair loss seen mostly in patches, also named as areata, which means you lose more hair in one place of your head than the other. Here your own immune system mistakenly attacks your own hair follicles, causing inflammation, which in turn causes hair loss. Here both genetic and epigenetic factors play a role, like high stress levels, poor diet, irregular sleep patterns, and so on and so forth. So the treatment for this condition is steroids, other anti-inflammatory drugs that suppress your own immunity, which are given in the form of local injections, topical ointment applications, or orally. Another form of hair loss is called as traction alopecia. It is a form of hair loss that results from prolonged or repetitive traction or pulling of your scalp hair, most commonly seen in females wearing hair in tight ponytails for longer periods, commonly seen in our sick religious patients wherein hair is knotted in the frontal region. It is a form of hair loss in which mechanical damage like pulling of your hair follicle caused by traction or pulling causes the hair to be damaged. Gymnasts, military personnel, and other professionals who are required to wear their hair pulled back also develop this kind of alopecia. Also, women wearing hair ornaments for a long period of time, such as grips or slides, also develop this condition. When your hair is pulled for prolonged periods, it starts to get loose from the roots and eventually breaks and falls off. So the hair roots, which are subjected to constant pulling, they get more and more damaged and scarred that they no longer are able to produce new hair, causing balding. So the treatment for traction alopecia, if at all possible, is to avoid tight haircuts. If a person's occupation or religion dictates that they wear their hair up or in tight buns, like in Sikh community, they should tie their hair as loosely as possible and wear it down or loose as often as feasible. Limit your exposure to chemicals, including relaxants, mostly in cases of females. Wear thick loose braids rather than short tight braids. Swipe the elastic hair ties for cloth ones. Keep your hair as loose as you can. So this was all about hair loss, its different types and their treatments. If you found this video to be informative, then please like and subscribe to our channel and press the bell icon to get new video updates. This will indeed motivate us make more such informative videos through which we can contribute in a valuable way in your hair loss journey. So thank you for watching. If you have any questions which come to your mind regarding this topic or any matter that comes to your mind about hair loss, I'll be more than happy to help you. Till then, this is Dr. Rahul Jagiasi signing off. Bye-bye.